It's 101.9 FM, KVSH. Our theme today has been altered states, and the reason for that, or one of the reasons for that, is that we have Dr. Ethan Russo here to talk with us about his cannabis travel log. Welcome, Dr. Russo.
Well, thank you. It's a pleasure to be here.
What inspired you to take off to Morocco and
Story that fishermen would go out at night and they could see better their way around because they would drink a cannabis tincture beforehand. And apparently he went out with them. He couldn't see anything, but they were maneuvering around the reefs and they didn't hit anything. So he reported this in Nature, and I always thought it was interesting and should be followed up. Subsequently, some years later in a journal in French, I saw an exactly similar report from Morocco, and it's a situation of the Moroccan fishermen didn't know anything about the Jamaican fishermen, and at that point I decided that this really needed to be researched. So I contacted the lead author, who is Abdurrahman Merzuki, who has joint professorships in Morocco and Spain, and said, let's try and study this scientifically. Subsequently, a few months later, I was going to Spain, to Granada, to serve on his thesis committee. On the next year, in 2002, we had arranged an expedition. I found some equipment that could test night vision, and so we could test before and after to see if cannabis did produce an improvement, and that proved to be the case. So subsequently, we were able to publish that, and had quite an adventure in Morocco in the meantime.
I bet. So, are you saying that driving at night is improved if you're high?
Well, as with many things, there could be pros and cons. If someone's too high, they get distracted and they tend to drive too slowly. So it's different than alcohol, where people take risks and overestimate their abilities. Unfortunately, we established that the dose of cannabis that's required to actually improve night vision is pretty high. And in other words, the person who's trying to pursue that improved vision may be high at the same time. So it's unlike some medical effects of cannabis, where clearly you can get improvement in pain without the need to be inebriated or have a psychoactive effect.
Would you explain to our listeners the differences? Because I think that can be confusing for people. There are different properties of cannabis that serve different purposes. Can you explain a little bit about those? I think it's THC, and I'm not sure what the other is.
So THC is the main psychoactive ingredient in cannabis, but by no means the only one that's active pharmacologically. But it's the one that people know the most about. In the past, a lot of people relegated the benefits of cannabis to the idea that people were high and they just felt better. Mm-hmm. Feeling better is the idea of medicine, to my understanding.
Yes.
But beyond that, it's been established with modern clinical trials that one can have benefits on symptoms like pain, muscle tightness, nausea even, without the need of having an altered state. So this is in contradistinction to your theme today, but anyway, in other words, there may be a sweet spot, particularly with certain kinds of cannabis, where one can have the benefit of symptom reduction without impairment. So that, for instance, if someone had a chronic medical condition, needed cannabis for it, they could still work or study effectively.
And what, what is the property in cannabis other than THC? I'm trying to remember the name of it. That's why I'm asking.
Oh, cannabidiol, perhaps? Right. There are many other components. Cannabis has over 500 compounds in it. The ones that are best known are THC, tetrahydrocannabinol. Another that's really come to the fore in the last few years is cannabidiol, or CBD.
CBD, that was
CBD is quite distinct from THC in that it's non-intoxicating. Tends to produce an alertness rather than sleepiness. Additionally, it's a strong anticonvulsant. It's good for epilepsy. It's an antipsychotic. Too much THC alone can make people feel crazy or paranoid,
Sure.
and that's counteracted by cannabidiol.
Is that what would be beneficial for cancer patients who are undergoing treatment for?
Right. Actually, both are. Um, Obviously, with THC, it's rate limited by the psychoactivity, and one needs very, very high doses of cannabinoids to primarily treat cancer. With CBD, you don't have this psychoactive side effect problem, and so high doses are attainable. But generally speaking, for most kinds of tumors, both are helpful, and a combination may be best.
So are you saying that cannabis, that part of cannabis, can actually treat cancer, not just the symptoms?
Right. And what's unique about the cannabinoids in treating cancer is they are toxic to the cancer cells while being preservative for the normal cells. So this is quite in contradistinction to conventional chemotherapy, where they're toxic for all cells. And this is why people who are undergoing treatment for cancer may lose their hair and slough their gut lining
Right.
because of this general toxicity. So the approach there is try to kill the tumor before you kill the patient. With cannabinoids, we're actually trying to kill the tumor and keep the other cells healthy. So there are all these side benefits because both THC and CBD treat the nausea that's associated with cancer and with chemotherapy. They simultaneously treat pain, improve sleep, and so there are all these side benefits, if you will, to this kind of treatment.
So why hasn't Western medicine embraced this treatment for cancer with both arms?
I'm afraid it's a political issue, and people form moral judgments on what should be a medical and scientific decision. Actually, other nations are more advanced than we are in their attitudes about this, and I hope that will change. I'm got to be honest, I'm not optimistic right this moment, but that's another story.
Yeah. You're going to be making a presentation at the Vashon Theater tomorrow night, Thursday, January 19th, about your trip through your travelogue through Morocco and China.
Right.
What are you going to be telling folks that you learned? Is it beyond the issue of night vision improvement?
Oh, yeah, certainly. We're going to have a little bit of scientific aspect, like we just discussed
Yes.
with the night vision. But additionally, there'll be some nice photographs and stories, hopefully a little bit of humor. But I hope it'll be entertaining and educational for people. Just to mention, in China, in Xinjiang, which is in the far west, very remote area, what happened with that was I was in Arlington, Virginia, and a friend called me to say, "You've got to look at this." There was an advanced online version of this article saying that they'd found the grave of this shaman in Xinjiang, along with a huge amount of cannabis, and they were able to identify it. And I was fascinated, but what I noticed immediately was they didn't have chemical analysis of the cannabis. So I thought this needed to be done. I immediately contacted my boss to see if this is something that we could study, and I contacted the lead author, Professor Li Chengsen, to see if he'd be interested in collaboration. And this all came together within about 20 minutes.
Wow.
Which is miraculous because
Yeah.
normally these are both people that are hard to reach.
Yeah.
But over the course of the next 2 years, we went through 11 months of bureaucracy to get some of the cannabis from China to England, where we did the analyses. And it was so well preserved that we not only did chemical analyses that proved that this was a drug strain of cannabis and not one that was likely used for fabric like hemp. Additionally, the state of preservation was such that we were able to do a genetic analysis of it, again showing that it was a drug strain and that this would have been used for medical purposes or for properties of divination by the shaman.
Yeah.
And then I was able to go to Xinjiang and do a field study with our team over there redig the tomb, establish some parameters, and again, have a lot of adventures associated with that.
This is fascinating. We're talking on the Morning Scramble with Dr. Ethan Russo, who will be presenting his cannabis travelogue tomorrow night at the Vashon Theater. What time?
It is at 7:30. And so I'll probably talk for about 70 minutes, and we'll leave about 20 minutes for questions.
I have a quick question. How was it preserved? What was the method of preservation? Was it just airtight? Was it?
Well, the grave ultimately was likely airtight. This is an area that's extremely arid, and it's a cool desert. It's part of the extended Gobi Desert. Additionally, the conditions there are very alkaline. So between those things, the coolness, the alkaline nature of things, the cannabis was extremely well preserved. And there was a air chamber in the tomb. We'll be able to show pictures of all of this.
Amazing.
But yeah, it was very scientific. The reason we had to redig the tomb was I wanted to take the temperature down there and show that it was cool enough to aid in the preservation.
This is fascinating. Where could people read more about this in preparation for tomorrow night? If they wanted to look up a few things.
They'd be welcome to email me. That's my name, Ethan Russo, ETHANRUSSO, at Comcast.net. Both of these studies about the expeditions were published, and so it'd be easiest for them to email me. We'll send them the articles, but I hope that they'd come anyway so they can see the pictures.
Oh, it sounds fascinating. I am fascinated by the whole idea of a Chinese shaman using it. And how old did you say this tomb was?
The ultimate radiocarbon dating was 2,700 years old. And I would just add that this fellow apparently wasn't ethnic Chinese. He was a member of what the Chinese call the Gushi tribe. Actually, this is a Caucasian individual, probably a speaker of an extinct language called Tocharian, which most closely resembles the Celtic languages. And in their clothing, they wore tartans. So these were nomads of the desert. It was only at that time that the Chinese were actually first having contact with these visitors from the West, as it were.
So we're talking Irish kilt-wearing crazy guys going to China and teaching them about cannabis and how to reach God.
Well, as
or
best
whatever,
we know.
the divine.
Or for a remedy.
Sure.
Yeah.
Well, the Chinese had a tradition of their own of using cannabis, but we don't know much about what the exchange of ideas was. But eventually, that came to pass.
It's amazing to me that you found out as much as you have, like through the carbon dating and the DNA of the origins of this individual. Dr. Ethan Russo, you are a Vashon Island resident, is that correct?
That is correct. I'm proud to say I'm coming up on my 10th anniversary here.
Yeah. And your presentation tomorrow night is sponsored by a couple of Vashon Island organizations. What are they?
Well, I'll hand it over to Shango.
Shango Los, welcome to our studio.
Thanks for having me.
So you're going to tell us about who benefits from tomorrow night's presentation.
Sure. So first of all, I want to let you know that the doors are actually open at 7:30. The presentation is from 8 until 9:30. Tickets are only $5, which is ridiculously low to see someone as esteemed as Dr. Russo. But we wanted to make it available to everybody, right? Because this is interesting information to all sorts of humans, right? Yeah. And then the event itself is sponsored by two of the island's licensed cannabis producers, Vashon Velvet and Vashon Island Organics. And it's also being sponsored by the island's Vashon Island Marijuana Enthusiasts Alliance, which we've talked about on your program before.
Yes, you have.
Is that the VMEA?
Vimea. V-I-M-E-A,
okay.
Correct.
Good memory, Jan.
Barely, I forgot the I.
I want to thank you both for joining us this morning. Dr. Russo, this is fascinating.
It is. I can't wait to go.
Yeah, really. What would you like to leave our listeners with?
Just hopefully that they'd have an open mind about the medical possibilities for cannabis treatment. And again, I hope that people would be able to make the show and learn a little bit more and hopefully be entertained for the evening.
Well, and before you go, the medical prospects of cannabis are intriguing and, to my mind, important for us to know. How can people access this if it's not currently accepted by Western medicine or even legal in some cases? I'm not sure. I'm so confused about the cannabis laws in the state right now.
It's in Washington State for access than many other places. And again, this is an evolving situation. And I would just encourage people to read as much as they can, get involved politically if they wish to advance this agenda for the availability of cannabis for medical usage. And I would just encourage them to try to pursue that.
In that vein, are there any online media information sites that you could steer people towards to get some general information about what we could do here in the state and what's available?
There are many that come to mind.
Maybe you can provide those to us, and we'll make them available. If you want to send me an email with that information, we'll put it up on the Voice of Vashon website.
Well, that'd be great.
On
and
Facebook,
we'll do
yeah.
that.
Or go to ethanrusso@comcast.net, correct?
Sure. And, again, if people would like the articles in advance of the presentation, I'd be happy to send those.
That'd be excellent. Now I'm curious about one more thing. You are an MD,
Right.
in Western medicine. How is it you continue to be funded to do these kinds of research explorations?
Well, funding has been a real issue, I'll be honest. My prior employment with GW Pharmaceuticals, this was the only independent research project that I was able to do during my 11 years there full time. But how I got into this is, I was trained in a traditional fashion in Western medicine, but after 7 years in practice, it occurred to me that I was using increasingly toxic drugs on my patients with less and less benefit, which led me back to an old interest in herbal medicine, which I gradually incorporated into my practice based on scientific principles. And of course, that included cannabis, which is probably the herbal remedy par excellence.
Mm-hmm.
Fascinating. I think we could talk about this for days. I hope you'll come back and visit us.
I'd be happy to anytime. I just live down the street.
Great.
Well,
It's 8:43 on KVSH. It's the Wednesday Morning Scramble. We've been talking with Dr. Ethan Russo and with Shango Los. Dr. Russo is going to be presenting his cannabis travelogue, using cannabis to see in the dark in Morocco and exhuming a cannabis shaman in China. This is better than TV.
Yeah. Everything's better
And
than
it's
TV.
tomorrow night at 7:30 at the Vashon Theater. I'm Susan McCabe. It's the Wednesday Morning Scramble. I'm here with my wonderful billing co-host, Jan Laughlin.